Emma, I was at a meeting a couple of weeks ago discussing Tilbury Health, the situation of crisis, etc. If there was one statistic that came out, was they said we are short of 14 GPs in Tilbury. Get those 14 GPs, we'll now get to the national average. Is that achievable?
Two answers. One, is it financially achievable? That's up to the NHS. We've known about underfunding in Tilbury for years. I mean, I've been here 15 years. Underfunding has been talked about for 15 years. So it's up to them to reach into their pockets, take money where it's being wasted and bring it to Tilbury where it's really needed. The second problem is, do we have 14 GPs, talking numbers? And the third problem is, do we have 14 GPs who are willing to come and work in Tilbury? Tilbury is famous for being highly deprived. That means hard work. It means spending more time with patients, seeing them more often. And if you could earn the same money by working in a place that is less than money, why would you want to come to Tilbury? So I think the NHS has known about this problem for years. And the question is, why haven't we acted before? I've been here for 15 years. We've been talking about this for 15 years. I'll show you the documents. There's a project called Getting It Right. I think the first letter I received was in 2008, acknowledging that Tilbury, I'll read it to you. I'm writing to you in the background of the clinical service review that is being carried out by Assura. Assura used to provide medical services. And you know, Tilbury has been identified as a locality with significant deprivation and health inequalities. This is 2008. And I know, you know, when I first came to Tilbury, the CEO of the PCG then was saying to me that this is an area of high deprivation. For instance, had the highest, one of the highest rates of gastroenteritis in the country due to poor hygiene. So why haven't they done anything about it yet? And how is anyone going to believe that therefore they will do anything about it?
So do you think we could be sitting here, well, maybe in 15 years' time, and we're still in the same situation?
Well, it's up to the NHS to act. I think the NHS gets away with murder because politicians promise the earth and deliver nothing, maybe a clod of earth. As I say, we've known about deprivation, we've known about the need in Tilbury. I've never worked so hard in my life as a GP than I have in Tilbury, because the need is great and the provision is small. I think I was looking at my notes. In 2000 I approached the PCG then, or PCT, I'm not sure, because I had 3,400 patients on my own on 2 sites. The national average was about 2,000 patients per GP, so I had far more patients. And it's only fair that they approved me for another partner or 3/4 of a full-time partner. They refused flatly because they weren't willing to pay. And they expect people to slave away. And so it's dishonest to talk about the problem. And the tone in the media when the NHS talks about general practice is GPs are not working hard enough, GPs are failing, GPs, you know, was it this morning or last night? GPs are not diagnosing cancer. I mean, let's say I send someone with suspected cancer, they don't get seen for 3 to 4 weeks. But we're not failing to see people, we're actually working harder than ever, but they need to put their money where their mouth is.
How many patients do you have now in this particular centre?
This centre, probably 4,900.
That's a lot, isn't it?
It is, but we have the equivalent of 2 full-time GPs.
And are you coping?
Am I coping? The only way to cope is to work harder. And I think most GPs are suffering from burnout. That's why I want to retire. You know, I think you work harder for less, and the government never says thank you. I mean, we have every year saved hundreds of thousands of pounds on prudent referrals and prescribing. You don't get any acknowledgement. And when we just talking about more GPs, and I think it leads to deprivation. This is an area of high deprivation. It means higher disease prevalence. It means managing people with those diseases is harder work. And it should mean you should get more GPs here. You should be paid to employ more GPs, but we don't. So if you look at the national average, if you look at what was called PMS, which stood for Personal Medical Services, and that contract was created for 2 reasons. One is to probably take us towards privatization, because then it was followed on by a PMS, which is for private companies to take over. But the more important factor was a GP could say, look, Tilbury is different. Can I negotiate? Can I, for instance, have more appointments for smears? Can we have a Saturday service? In 8 or 9 years as a PMS practice, I have never been able to persuade the PCT or the area team to negotiate anything with me, despite my practice having 5 contract variations which entitle us to ask, PMS aside. And my practice was on £64 per patient. The average was on 84. That's a huge difference of £200,000 a year. How many GPs can you employ? Now, if you think a practice in an area of highest deprivation should draw more than average funding, we were way below average. And just for negotiating, to be brought up to average, the manager then just withdrew from the meeting, just walked out. So I think the NHS is guilty of unfairness, injustice, inequality. I mean, we talk about equality in the NHS. They opened the walk-in centre in Grays. Its official name is Equitable Access. How is that equitable when you put it in an area of lower need and you fail to put it in Tilbury? It should have been put in Tilbury. We tried to negotiate Saturday opening for Tilbury, and I could show you documents, negotiations, and I had a business plan, and it just was kicked into the long grass, and that's how things disappear. They just stop talking to you. We've provided evidence. Carol and I worked on a Saturday for 9 months. We showed them a 10% drop in A&E use, let alone the savings for our poor patients who have to take a bus to go to A&E. No, didn't make a difference. They wouldn't negotiate. So, and I think I'll give you other examples. In roughly 2008-9, Thurrock saved something like 20 million. The money, rather than being reinvested in Tilbury and the locality, it was sent to North Essex because they were short of money, where they have loads of money. So I think the problem with the NHS, it's hypocrisy. They talk about equality, there is no equality, and that is maintained deliberately. I challenged one of the PCT managers at the time. I said to her, my budget is far lower than the average PMS. Help us, give us more so we can employ more GPs. She said, I can't. Why can't you? Do you agree it's unfair? Yes, I agree. So why don't you do something about it? She said, because I have to take it from the rich areas and they shout louder. So I think Tilbury is deprived in more than one sense. I think deprivation is an active process of neglect, deliberate underfunding, because it's convenient. And I think the people of Tilbury should be out in the streets. They should be actually wherever the area team is demonstrating, camping outside till the NHS puts money where it should be.
But isn't that the point? The meeting was held a couple of weeks ago. I think I counted about 14 members of the public. A town of 12,000 people. I guess that's why people can get away with things, isn't it? Because
yes, I don't know how well advertised the meeting was, but I can tell you I wasn't invited, and I'm one of, I have more patients than most GPs in this town. I think we had an email the day before sent to my practice manager, and it's not for lack of meetings. I told you about the Get It Right. We had loads of meetings in 2009. Never led to anything. It's just talk, talk, talk. And maybe people knew about it, but they knew that, or had no faith in the NHS. So why attend? It's all talk, talk, talk. And I think what we need, we know what needs to be done. We just need the integrity. People in responsible positions need to have the integrity to move money from where it's not needed to where it is needed. Just have genuine equality. Now then somebody may come to you and say, oh, now this practice is under GMS. GMS is a national contract, so everybody gets paid the same. Well, that in itself is not fair. We shouldn't get the same, we should get more, because our need is greater. And that's only a recent change, and I had no choice but to go to GMS, because it gave me slightly more money, £1.50 per patient per year. Didn't have a choice. But and I think there's a lot of misinformation. People are being led. So whilst the NHS is failing to fund health in areas of high deprivation, They are blaming GPs all the time. I mean, the CQC is just another attempt. I still maintain my protest. I still haven't had answers. We've had a second visit, but you know, we are overworked and underfunded. It's that simple. We suffer from the national picture. General practice as a whole has had reduced funding and increased demand. Demand by the public, because that's the culture of the culture, is the slightest problem gets medicalised. And NHS generated demand. I did a little calculation before you came today. There are new protocols every so often which increase the demand on GPs, and the NHS, who announces these new standards, they don't calculate the cost of general practice. I'll give you one small example. If you say to GPs that any adult on your list with a cardiovascular risk of 10% or more should be put on a statin, that equates to about 1,200 adults on my list. If you give them 2 appointments per year, one to do a blood test, another to discuss, maybe a third because some people may react, they may, you know, let's say 2, that's 2,400 extra appointments a year. That's just for one little protocol. There are so many, and the demand has been increasing, but the supply has gone down. And I think politicians need to be honest, rather than promise things to gain votes and then, you know, knowingly fail to deliver because they had no intention of delivering. Why don't you just say to the public, look, we have a finite budget, let's live within our budget, don't expect too much. At the same time, be fair and practice, you know, equality. Move